Hi, my name is Sarah and I'll be completing a head-to-toe assessment today on patient JS. Do you have any pain, tenderness, or areas of concern today? Okay, can you just tell me the first letter of your first initial of your first name?
J.
And do you know where you are today?
At the doctor's office.
Okay, and do you know what day it is?
Monday.
Good. So patient is alert and oriented ×3. Level of consciousness and mental status is good. Patient has positive mood and affect. Has ability to speak, hear, and answer questions. Patient is well groomed, demonstrated by hair being brushed well, wrinkle-free clothing, and wearing clothing appropriate for the weather. Patient has good hygiene, no odor detected. Patient has good posture, demonstrated by sitting up straight. Patient has ability to symmetrically move all extremities. Patient's skin color is good, and according to patient's race, which is Caucasian white. Okay, so now I'm just going to check your blood pressure. We're going to check your blood pressure on both of your arms today. I can have you put your feet flat on the floor. (110/72). So that's within a normal range of the normal being 120/80. And now for your other arm. And I'll have you lift your arm up. We can rest it just like this, so it's above your heart. (108/72). So again, we can expect your finding. Okay, now I'm just going to take a look at your scalp. So I'll have you move your head this way, and you'll feel my touch. Skin on scalp is smooth and intact. No lesions, flakiness, or openness noted. Any pain at all with palpation?
No.
Okay. Cranium is round. No bulging or depression is noted. Also no pain or tenderness upon palpation. Good. Now if you look at me, so face is smooth, skin on face is smooth and intact. Now I'll have you close your eyes. Can you feel this?
Yes.
And this?
Yes.
And this?
Yes.
Okay, you can open your eyes so if the patient is able to feel light sensation. I'll have you close your eyes again. And can you feel this?
Yes.
And this?
Yes.
And this?
Yes.
Good. Patient's able to feel deep sensation. Now you close your eyes tight and wrinkle your forehead and stick out your tongue and smile and blow up your cheeks. Good. So patient's facial features are symmetric bilaterally. You can open your eyes, and facial cranium nerve is also intact. Okay, now I'm going to palpate your sinuses. So we'll start with your frontal sinuses. You can close your eyes. Any pain or tenderness upon palpation?
No.
And your maxillary sinuses, any pain or tenderness?
Nope.
Good. So no pain or tenderness noted. And now for your temporal arteries, I'm going to place my fingers on your temporal bone. Good. So temporal artery is smooth, non-tender, with pulsation noted. Now checking for your TMJ, I'm going to place my fingers on your jawline. Open your mouth slowly, close slowly. Move your jaw from side to side. Any pain or tenderness?
No.
Good. So patient is able to move jaw easily and smoothly with no pain, tenderness, or cracking noted. Okay, now I'll have you close your eyes. Just going to inspect your eyelids. So eyelid skin is smooth and intact. Eyebrows are symmetric and extend over the eye. Eyelashes are distributed equally with slightly curled outward. Skin on eyelid corresponds with the rest of the skin on the facial features. Eyelid margin skin is pale pink and fits flush with the eyeball. Lid closure is complete with smooth and easy motion. Blinking is bilateral and involuntary and frequent. No drainage or discharge noted in the inner or outer canthus of the eye. No flakiness noted in the eyebrows or eyelids. Okay, so now I'm just going to take a look at your eye. So you'll feel my touch pulling up and move your eye up and down. Good. And below. Good. Next eye. Up and down. Good. Okay. Now I'm just going to shine a light from the side and the other side. And now standing 12 to 15 inches away from your eye, checking for your cornea light reflex. Good. So scleria of eye is white, no yellow or redness noted. Conjunctiva of eye is pink, no redness or cyanosis. Cornea of eye is smooth and round. No lesions or abrasions noted. Iris is round and consistent in color. Okay, now we'll check your vision. So if you can stand up and we'll do the Snellen chart. So I'll have you cover one eye and read the lowest line that you can.
F, P, C, D, T, Z, L, E.
Okay, and next eye, same thing.
F, P, C, D, T, Z, L, E.
Good. Okay, so patient's vision is 20/16 with no use of contacts or glasses. Okay, and now I'm going to have you take one of these, and I'll take one. Okay, and I'm going to cover the opposite eye, and tell me when you can see the object.
I can see it.
Okay, and again.
I can see it.
Good,
I can see it.
and
I
again.
can see it.
Good, and now next eye.
I can see it. I can see it. I can see it.
Good. Okay. Patient's visual fields are intact, no peripheral loss noted, no optic nerve impairment. Okay. Now I'll have you follow my finger, only moving your eyes. Good. So patient's 6 corneal fields of vision is intact. No myastigmas is noted. And now I'm going to have you stare at an object from across the room. So focus on any object across the room. Good, and now look at an object up close. Okay, so patient's eyes dilate with looking at distant objects and constrict with looking at up close objects. So patient's eyes are equal and round and react to light equally accommodating. Okay, so now just going to look at the red reflex of your eyes. And next eye. Good. So no dark spots noted, so this is an expected finding. Okay, and now we're going to look at your ears, so you'll feel my touch on your ears. Any pain or tenderness with palpation?
No.
Okay, skin Skin on ears is smooth and intact, corresponds with color of rest of facial features. Pinna of ear is flexible and hard and corresponds directly with the outer canthus of the eye. Size of ears is equally bilateral. Lobes of ear, soft and squishy. No lesions, redness noted. So now we'll look in your ear. Okay, so inner ear canal is pink. Tympanic membrane is translucent with a pearly gray in color. No foreign body lesions or redness noted. Moderate amount of serum that is moist, brown and gray. No odor noted. No drainage from ears. Okay? And so now I'm going to have you cover one ear with one hand, and repeat what I say. Car, truck, car.
Car, truck, car.
Okay, and now for the other ear. Plane, train, plane.
Plane, train, plane.
Okay, patient was able to repeat what I said accurately. And now to perform the Weber's test. With a tuning fork, so I'm going to put this in the back of your head and tell me which ear you hear the vibrations more or if it is equal.
Equal.
Good, so that is an expected finding. And now for the Ryan's test. With the tuning fork to put in the back of your ear, tell me when you're done, when you don't hear the vibrations anymore, and then I'll put it in front of your ear, and again, tell me when you can no longer hear the vibration anymore.
I can't hear it anymore. I can't hear it anymore.
Okay, and now for your other ear.
Can't hear it anymore. Can't hear it anymore.
Okay. So patient was able to hear vibrations twice as long when it was in front of her ear rather than the back of the ear. This is an expected finding. Okay, so now looking at patient's nose. So you'll feel me touch your nose. Patient's skin is smooth and intact. Color corresponds with the same color as rest of facial features. Nostrils are symmetric bilateral. Nasal septum is midline. No nasal flaring or narrowing is noted. Okay. Now to take a look just inside of your nostril. Tilt your head back. Good. Okay. And next. Good. Patient's nasal cavity is pink. No redness lesions or foreign body is noted. No drainage from nasals. Turbinate and nasal septum is midline. And now I'll have you close your eyes and tell me what you smell.
Coffee.
Good. That is correct. And now I'm going to cover one of your nostrils and have you sniff. Sniff. And next. Good. So patient's air exchange is equal bilaterally. Okay, now looking at your lips. Patient's lips are pink in color, smooth and moist, no crackiness, dryness, or lesions are noted. I'll have you open your mouth. Okay. So patient's gum line is straight with teeth. Teeth are straight and white in color. No yellow or discoloration is noted. I'll have you open your mouth wide. Oral mucosa is pink. No lesions noted. Stick out your tongue. Tongue is symmetric and pink in color with rough texture. No dental caries are noted. Hard palate is pink with smooth texture. And then I'll have you say ah, ah. Patient's ovula is midline. When patient says ah, ovula and soft palate remain midline and stay together. Soft palate is also pink. Tonsils extend past the posterior pillars. If I can have you move your tongue up and down and then side to side. Good. Patient is able to move tongue in all directions. Okay, now looking at patient's neck. Neck is centered. No lesions noted. Patient's skin color on neck corresponds with the patient's rest of the body. I'm going to have a feel. So patient's trachea is midline. Checking patient's carotid one at a time. Pulsations are noted. And now checking for lymph nodes. Preauricular, parotid, postauricular, acceptable, retropharyngeal, submandibular, and submental. No lymph nodes noted, so no infection or inflammation observed. Now to check for bruise with the bell of my stethoscope. Good, no bruise noted. Now checking for your thyroid, you'll feel my finger press against your trachea and I'll have you swallow. Go ahead and swallow. And next, swallow. Good, so thyroid was not palpated. This is an expected finding. Now if I can check your range of motion, so I'll have you move your head down and back and to the side, other side, and then around and the other side. Good. Okay, and now checking for your sternomastoid and your trapeze muscle strength. So sternoid, mastoid, and trapeze muscles are straight, symmetric, bilateral. I'll have you push your head against my hand. Good. Good. So patient has positive sternomastoid muscles. And now if I'll have you shrug your shoulders. Good. Strength is equal bilateral. Okay, so now I'll have you, we're going to check your back. So I'll have you turn. Perfect. Patient's back is muscular, is straight and symmetric. Sternoid process. Feeling for the sternoid process is straight. So if you'll need palpate, any pain or tenderness upon palpation?
No.
Good. Okay. And now I'll listen to your lungs. Take a deep breath. And again. And again. Again. One more time. And last time. Lung sounds are clear bilateral and laterally. Now to percuss on your back. Any pain or tenderness?
No.
Okay, response is heard on all areas of the back, and now checking for the CVA. Any pain or tenderness?
No.
Okay, so no pain or tenderness on CVA, no inflammation or infection of the kidneys then. Okay, also with palpation, no bulging noted. Okay, so now we'll have you go to the bed and we'll check your abdomen. Okay, so first looking at patient's chest is symmetric. Respirations are 16, and that is within an expected finding. Patient's breathing pattern is normal. Okay, so now we'll listen to your heart and lung sounds. All areas of heart and lung sounds are normal, lung sounds are clear, no extra heart sounds or murmurs were heard. Now I'm going to listen again to the heart and lung sounds with the bell of my stethoscope, and then we'll listen to your apical pulse for 30 seconds. Okay, good. Again, lung sounds were clear, no extra heart sounds were heard. Apical pulse was 72 today, so that is within the expected range. So now while I have you laying down, I'm going to have you put your head to this side, and we're going to check for any jugular vein distensions of your neck. So I'll have you turn your head. Good. And just grab a light. Good. And now on other side. Good. No jugular vein distension is noted. Okay, and then I'm just going to palpate lymph nodes on your neck as well. Good. No lymph nodes palpated. This is an expected finding. And now I'm going to percuss on your chest. Good. Okay. And now I'm going to check your abdomen. So I'll have you lift up your shirt just a little bit. Perfect. So abdomen is, color is, corresponds with the rest of the body. No lesions noted. Contour abdomen is round. And symmetric. Okay, so first I'm going to listen to your bowel sounds. Good. Bowel sounds were heard in all 4 quadrants. No hyperactivity or hypoactivity, so no constipation or bowel obstructions. Now you'll feel me palpate on your stomach for about 1 to 2 inches down. Any pain at all with palpation?
No.
Good. Okay, now I'm going to press deeper down about 4 to 6 centimeters. Any pain or palpation?
No.
Okay. So now you'll feel me percuss on your abdomen. Any pain or tenderness? Okay. Tympanic was heard on all quadrants of the abdomen. And now I'm going to check for the aorta brewing. Okay, no bruit heard. And now checking for femoral pulses. So I'll check in the middle of your legs. Femoral pulses are observed, and now checking for any lymph nodes, any pain or tenderness.
No.
Okay, so no pain or tenderness, no infection or inflammation. Now, of course, you will not have to do a testicular exam. However, if you were, what we'd want you to do is to do 1 testicle at a time, and with your finger and your thumb, gently rub each testicle and feel for any lumps, change in sizes, and then if you did, we would want you to see a doctor. Okay, now I'm going to check your axilla lymph nodes. Any pain or tenderness?
No.
Okay, no lymph nodes noted. Now I'll come over here and check for your other side. Any pain or tenderness noted?
No.
Okay, and for breast exams, what we will want you to do is put 1 hand over your head, and with the other hand you would, in a circular motion from your armpit and around your breast and nipple, in a circular motion, feel for any lumps, bumps, or any changes in your breasts. Okay, so now we're going to check for range of motion. If I can have you put your knee to your chest, 1 at a time. Good. And now next, and put your legs straight up in the air. And your next leg straight up in the air. Good. And now if I can have you put your right foot to your left knee, and then push down on your leg. Good. And do the same thing with the other side. Good. And now I'll have you sit up. And range of motion for your shoulders, put your arms out, and then back, and then out sideways, and back, and your elbows up, good, and your wrists, good, and fingers, spread your fingers, and then put them together, and your thumb put together, and then out, both hands, squeeze my hands, good. Okay, and then checking for supination and pronation, so move your hands from front to back, good. And now testing for muscle strength. I'll have you put your hand out like this, press against my hand, and now up, good. And now go like this, we'll test for biceps and triceps. Hold my hands, good, and push my hands, good. And then wrists, I'll have you put your hands here and push on my hands and push on the back of my hands. Good. And now we'll check for your brachial pulses. Brachial pulses are palpated and equal and strong bilaterally, and your radial pulses, again, equally strong bilaterally. Okay, and now testing for your reflex of your brachial or your bronchoradial reflex. Good. And next hand. Good. And your deltoid. Good. Good. And your tricep. So good. Good. Okay. Now I'll have you close your eyes and I'm going to put an object in your hand and tell me what the object is.
Penny.
Good. And now keep your eyes closed with your other hand and we'll do that again. Good. Patient is able to observe the object and I'll put your hand out and tell me what I'm writing on your hand.
3.
Good. And next hand.
3.
Good. Okay. And now have you close your eyes again and tell me what kind of touch that you feel on your hand.
Soft touch.
Good. Other hand.
Soft touch.
Good. And then one more time.
Vibration.
Good.
Vibration.
Good. Patient is able to feel touch on hands. Okay. Now looking at the lower extremities. I'll have you, for your knee range of motion, put your arms, legs out. Good. And back in. Good. And for your feet, or your ankles, out. Good. And toes, curl them. Good. And put your feet outward and inward. Good. Okay, now checking for muscle strength. Push against my hands. And now again. Good. Patient's muscle strength is equal bilateral. And for your feet, press against my hands and up. Good. And now we'll check for the popliteal pulse. Pulsations noted. And the tibia pulse. And the pediis pulse. Good. And now checking for reflexes of your popliteal. Good. Good. And now for your ankles. Good. Good. Patient has positive reflexes of all extremities. Okay, so examining patient today, also looking at patient's skin assessment. So we're looking for any temperature changes, lesions, texture changes, Truger, pigmentation and color. Patient skin assessment is good. No changes in color or temperature throughout the body. I'll have you stand up. And checking for your spinal range of motion, I'll have you bend down and touch your toes. Good. And if I can have you rock across the room. And when you come back, walk from heel to toe. Good. And now on your tippy toes. Good. Patient has good balance and gait. Now for the Romberg sign, I'll have you close your eyes and stand as still as you can. Okay. Patient is showing good balance and gait. No swing or movement noted. Okay. And that completes the head to toe assessment today. Thank you.